Madam Secretary, can you call the roll, please?
Chair Jung is absent. Vice Chair Novak.
Here.
Oscar Delgado.
Here.
Dr. Hess.
Here.
Christopher Dare.
Present.
Michael Brown.
Here.
Tom Young.
Here.
We have a quorum.
Thank you very much. Ms. Albert, would you lead us in the pledge, please?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
Mr. Chair.
Okay.
Mr. Chair. Before we proceed, I'd like to share some sad news with everybody. We lost one of our health district employees this morning. Darlene Bidlake passed away unexpectedly at her home. And so I'd like to take a moment of silence. Thank you. Thank you, and our condolences to her family and friends.
Ms. Roger, any public comment at this point? Thank you very much. We have any comments, changes, corrections to the agenda? Hearing none, do I hear a motion to accept?
Motion to accept.
Second.
Okay. Accepted, motioned, and Christopher Dyer second. All in favor?
Aye.
Opposed? Motion's carried. Okay, we have recognitions.
All right, thank you, Mr. Chair. And I'd like to just flip the order on years of service and start with by recognizing Daniel Inoue. Dan, if you could stand up. Daniel's been with the Health District for 20 years now, and Dan is the branch chief for the monitoring and planning branch in our air quality management division. So congratulations, Dan, and stick around. We'll take pictures here in a few minutes. The next years of service recognition I have is for David Orozco, and David's not able to be here today, but I switched the order there because I also wanted to announce, as often happens when somebody hits 25 years of service as he has, is that Mr. Orozco is also going to be retiring here early in May. So congratulations to Mr. Orozco. And then I'd like to ask Anna Heenan to come up to introduce Jennifer Pierce.
Good afternoon. I'm Anna Heenan, your Administrative Health Services Officer. For the record, I am very pleased to introduce Jennifer Pierce. She's our new Principal Account Clerk. She's worked in the County Treasurer's Office, and just recently she was at the Sheriff's Office as the Principal Account Clerk. And because she knew how great it is to work at the Health District, she transferred from the Sheriff's Office over to Health. So we're very lucky to have her. She brings a wealth of knowledge and information, and I'm looking forward to working with her. So please, welcome Jennifer for me.
Welcome aboard. Want to do your Shining Stars?
Yes, next we have Shining Stars, and we have several employees that have, as you'll recall, this is our employee recognition program for excellent customer service or service for the Health District. And Jessie Salem, and I don't think we have Jessie here because she's busy staffing the counter at Environmental Health, but has been recognized by customers for her customer service. So I'd love to see that recognition for the people doing a good job with the public at our counters at the Health District. And then we also have several, actually it's the entire Vitals program staff that are being recognized for Shining Star Awards. So we have Blair Hedrick, Victoria, Vicky Stebbins, and Carmen Mendoza with Blair and Vicki having 4, and Carmen 6 Shining Star Awards. So if you could stand up and be recognized. And so this is Carmen and Vicki, and I imagine Blair is probably also working at Vital. Oh, she's out today. Okay, so thanks for being here. And then we have a proclamation. So why don't I do the proclamation,
and then do pictures. Okay.
Then do pictures.
Sounds good.
And I'd like to ask Yenling Barnes and Stephanie Chen to join me to accept the proclamation. This proclamation is for National Bike Month and Bicycle Safety Month and Washoe County Bike Week. Whereas promoting alternative forms of transportation, such as bicycling, helps to improve health and well-being while reducing emissions, traffic congestion, and America's dependence on fossil fuels. And whereas creating bicycle-friendly communities has been shown to improve quality of life by fostering community spirit, improving traffic safety, and stimulating economic growth. And whereas bicycle infrastructure in the Truckee Meadows offers great potential and opportunities to positively impact our recreation and tourism industry by making the region attractive to residents, visitors, and new incoming businesses who enjoy healthy lifestyles in the outdoors. And whereas Nevadans will experience the joys and benefits of bicycling during the month of May through educational and safety programs, community events, or going for an individual or group bike rides. And whereas the education of our entire community on the proper and safe operation of motor vehicles and bicycles sharing the use of streets is important to ensure the safety and respect of all users on Nevada's roadways. And whereas the month of May has been declared National Bike Month since 1956, now therefore be it resolved that the Washoe County District Board of Health does hereby proclaim the month of May 2018 as National Bike Month and Bicycle Safety Month in Washoe County, Nevada, and the week of May 13th through 19th, 2018 as Washoe County Bike Week. So would you like to say anything? Okay.
Good afternoon, Mr. Vice Chair, members of the board. For the record, Yenling Barnes, Environmental Engineer with Air Quality Management Division. Just to remind everybody that the Bike Week in Washoe County is organized by the Truckee Meadows Bicycle Alliance, and which Stephanie Chen and I are members of. So we encourage you to participate if you can. You can check it out on bikewashoe.org, and Stephanie will tell you a little bit more.
Good afternoon, Stephanie Chen for the record. As a health educator for the Chronic Disease Prevention Program, we're extremely happy to support and also promote Bike Month and Bike Week so that we can encourage our community to be active in their lifestyles. Like Yen mentioned, during Bike Week, there's going to be numerous events taking place each day. The Truckee Meadows Bicycle Alliance worked hard to put events on, so we invite everyone to participate when they can. Thank you.
Can you give us your website again?
Bikewashoe.org, and we have saved the dates as well as all of the events for you.
Thank you very much. Great pictures.
Should we take a moment?
Oh, can we entertain a motion?
I'll make a motion.
Second?
Second. Third.
Third? Pick several. Okay, all in favor?
Aye.
Opposed? Passed, let's go. questions? Yes, sir.
Quick question, more information may clear up for me. So at Record Street, I think it's everyone's goal across the region to not have people go to our ERs. Can you kind of explain to me, or maybe another meeting, if somebody at Record Street calls 911, we show up, everybody shows up. But for example, Community Health Alliance has a clinic upstairs on the second floor. What prohibits somebody from walking somebody up to the second floor to take care versus taking them to the emergency room?
So if it's, I have that
Is that
information. I don't
okay.
know if it's okay to answer within the scope of this. I can provide you with that answer right now.
Within the scope of your agenda item.
Yeah. I'll make it fair. Okay, so you will see in the 5-year strategic plan that we are looking at implementing appropriate protocols to determine service levels through the EMD process for low acuity priority 3 calls. Record Street might be an example that would fall into that project. And so one of the things that we are doing is we have worked we've met with REMSA. We started meeting with REMSA and Reno Fire first. When we came before you as part of one of our updates, the franchise map review, which was also a strategic planning item. And we looked, there were 3 times the number of calls to Record Street than any other address in a single fiscal year. They had over 1,600 calls for service. The next one in line was the bus station, and so there would be some discussion that those are probably sharing clients. The third one, interestingly enough, is the jail. So that's a different topic. So with that, you obviously can't do a zone A+. And so we started looking at what response modalities look like and if the response could look different there. The clinic that's there, through some statistical analysis, we identified the top hours that are being used, and unfortunately the clinic is not open during those hours, and so that was something that we did identify as kind of a challenge. One of the projects that is being reviewed to see if it's a possibility is using that space, because evidently it's not a CHA owned space, it's a City of Reno owned space, and opening it up to the university medical students who run clinics at UNR, that perhaps they could run a clinic.
Late night shift or something?
Right, swing shift kind of thing. So another idea that we had talked about was doing 2-man teams. So they would sort of be the pre-911. So when you call 911, if it was to these addresses, they would deploy that pre-team. Because right now the fire truck goes and the ambulance, and then there's a lot of jumped calls. So that's something that's being looked at.
Gotcha.
So there's a lot of projects, and I'd be happy to bring it back to the board so that you can see the different things. When we met with REMSA and City of Reno, it then became a larger group that included CHA, that included the university, social work, and medicine, and so it was a larger group, and it became clear that it became outside the scope of the EMS oversight. So we sort of laid the foundation, everybody agreed on the projects, we put together a spreadsheet that says these were the projects that we're going to start exploring, who the lead agency was, and then the timeline for implementation. And I want to say there's like 5 or 6 outside of the 2 that I just shared with you.
Perfect. Thank you so much for that information. Appreciate it.
Yes, sir.
I'd like to kind of repeat a comment that I had made at the EMS Advisory Board, and this is in regard to the campaign that Chief Brown encouraged us to do to keep people from calling 911 inappropriately. And I think we've got a good start on that, and the Health District has invested in that. REMSA is providing in-kind contribution toward that. But the Health District doesn't get any economic benefit out of doing this campaign. And so I want to take advantage of this while I've got a couple of elected officials at the dais to point out that that the local jurisdictions do in the dispatch centers and in their emergency response services, and as well as the local hospitals in their ER rooms. So while we have a start to this campaign, I think it's going to take a long-term effort to really change behaviors in our community. And I think that a way to really make that impact and get the behavior change that we need is a campaign that involves each of the jurisdictions and the hospitals contributing toward a bigger campaign that can be more effective in changing those behaviors. So.
Mr. Dick, if I may just add to that, we've asked 2 different times. We have all the marketing materials, and we asked for the partners to be able to kick in either money or some kind of in-kind so that we can keep it going, because all research that we have found does show that it takes 12 to 18 months to sort of move the dial on thinking. And REMSA is the only one that commented back with their in-kind, and they're providing in-kind the media buy so that all of our money can go to the media, and they're picking up the cost from that in-between person.
Good. Anything else? Any other comments?
I have a question. Who is it you called? In our cities, I mean, who is it that you reached out to?
So I reach out to the fire chiefs as well as the dispatch supervisors, because they're the committee members that we utilize, and so it would then be incumbent upon them to push it through either through their budgets or through their councils to get the monetary support. So past our asks, I'm not sure what has happened.
Okay, thank you.
Yeah,
Good.
just reach out to me. We'll see if we can get something. I think it's very important that we
Okay.
part of it. So thank you so much.
Thank you.
Very good. Anything else? Okay, thank you very much.
Thank you.
Okay, next item on the agenda, Mr. Westham.
Good afternoon, Chad Westham, Division Director of Environmental Health Services for the record. This agenda item is as a result of Joseph Williams. He's the owner of a permitted food truck, Sunshine Ice Cream. He provided public comment at the March 22nd Board of Health meeting about the fee that he has to pay for his food truck, $485. He felt that it was unreasonable and he was struggling to pay the fee. Excuse me, the fee schedule and payment that he was referring to is set and established by the Board of Health, and any changes in the payment amount for Sunshine Ice Cream are a policy decision and are to be made by the Board of Health, although this would be a standalone situation. So we did look at the issue and evaluated the fee, and we contacted our legal counsel as well. And so at this point, we recommend that the board discuss whether they want to provide direction to make any changes to the collection of Sunshine Ice Cream permit fee. And options the board may wish to consider include taking no action, a fee payment plan, an adjustment of the fee due date, or some other accommodation you see fit. And that's all I have for you, pending any questions.
Dr. Hess?
Yeah, I can see why he's got difficulty because he's a seasonal food truck. Now, I'm assuming that fee is the same for whatever the food truck sells? So some are seasonal and some are not, is that true, or?
Yeah, Chad Weston for the record. Our fees currently are for food trucks, and that includes the very large food trucks you see that are RV style at the different events, and Friday night food truck, as well as these ice cream trucks and other lesser operations. It's an average of both the ones that take the most time as well as those that take less. But the fee does include the cost of licensing and inspecting that vehicle, as well as the food truck depot that the vehicle is required to come from and return to, and the supplies that are there, and then licensing and answering emails and questions about food trucks and other related topics.
So anybody that has a food truck, no matter the nature, pays this annually in, what was it, February? Is that the problem, as I understand it?
Yeah, Chad West for the record. So his is due in February. It's related to when he started up his business originally, I believe. We have different, this particular fee is not due in February for everyone. It's each permittee has a different renewal date.
So, I guess, is it possible to change the renewal date for an individual then, or?
Chad West for the record. Ms. Admiran, would you want to address that?
I think that would be a decision for the district health officer and this board. It's not really a legal decision. The review has to be on a yearly basis. You have to do the inspections, but when you collect the money, that would be a policy decision.
Go ahead, Mr. Pick.
So as the health officer, I don't believe that I have the authority to start changing dates that our fees are due of my own accord. I think we would need policy direction from the board. It's certainly feasible for us to adjust the date that we have the fee due for this permit. It's an annual permit fee that they're paying, and basically the date that fee is due was determined based on when they first applied for that permit, and then it's the same month every year. But if the board was to provide direction for us to change that due date, for instance, to push it back later into the year, that's certainly something that we could do. I would say that the potential risk there is that they're operating their food truck further into the year before we're collecting that payment, and they could decide to fold and go out of business, and we wouldn't get a payment for the period that they were under our oversight for their activities.
Yes, sir.
So my concern of any time we do something with people's fees is, and though I know that it sounds like he's having a hard time paying it, but if we're not careful, the precedent we set is that anybody who comes in and says, I have a struggle, I have a whatever, I have to move the date, and technically moving the date would mean, because he has a permit for a year, that the fee would have to be higher when it hit because of timing. Because if he pays yearly and it pays to February, and then we move it to July, let's say, that means he has so many months that now he had a permit longer, which is unfair to everybody else who had a permit. So I don't know, it becomes very interesting. I think we need to be careful when we talk about waiving a fee or anything like that. I don't think that's a wise idea. So when I sit back and I look at this, I just think the precedent we set, we need to be real careful. Because what if each person now comes to you every time they can't pay and they say, I want to, in 3 months, can I pay it in 3 months? Can I pay it in 4 months? If we start going down that road, you're going to really like this decision then at that point.
If I may, Chad West for the record, he did pay this fee. He paid it when it was due or in that time frame. He just wasn't pleased by it.
When does he start selling ice cream? I wouldn't think he could sell it in February, so.
Chad Westham, I
Yeah.
did have a number of conversations with him, and it was last week. So he said when the season is warmer, he does start sometimes in April, but I recall he said that he's always operating in May for sure, and he's been doing it for a number of years, if not decades.
Okay. Any other comments, discussion?
Chad, do other jurisdictions have any sort of graduated fee structure, something like that for big trucks, small trucks, seasonal businesses, a monthly license, or are you aware of any other sort of precedent that would be possibly a bit fair? I can see, the point that I don't think we should have 400 different fees for food trucks and things too, but is there an example that you know of that somebody else has, like you get a 3-month permit and you get a year permit or things like that?
Chad West for the record, there are other models out there, And at this point, we're collecting data with Excella and SAP and our other systems in the division, and we're collecting the data, checking it, and then as we get beyond this year, 2019, 2020, we'll go back and make sure that the fees are correct. And so we'll be looking at all those other models at that point. But as far as Sunshine Ice Cream, this Board of Health agenda item is just for Sunshine Ice Cream. And so
Sure.
I mean, we did look at the analysis of how much time we spend on that one and the averages and stuff. And it's that we have costs of the division that we have to recoup. And this is an average, but it's in the ballpark.
Sure.
I guess I'm struggling with why he even applies for it before he wants to start selling. I mean, I don't understand the mechanics, I guess, of this. I mean, it seems like if he doesn't start for 2 more months, why doesn't he just apply for it when he starts? Or just before he's gonna start?
Yeah, I can help with that.
Yeah.
It's a renewal. The permit is.
Let it expire and then start afresh. I don't know, doesn't make sense to me.
Yeah, it's a renewal permit. It's good for a year. And so he does get invoiced at about the same time each year. And this is probably related to when he started up his business originally. If he were to close out the business and then restart it, it would take a number of potentially weeks for our staff to, like if he hypothetically closed and then decided he would close in January, February, and then he would start up a brand new fee in May, let's say hypothetically, he would have to contact our staff. He'd have to have the paperwork and potentially a plan review. So it would just be a whole lot of extra steps for him and potentially added cost. So that's not advisable. These fees are on a renewal basis, annual renewal basis.
Any other comments or motion?
I'll make a motion.
Okay.
I'll make a motion that we don't do anything with it. And he paid it, and I don't think, if we want to come back and look at our fee structure, because we think there's a fee structure issue, that's a different conversation. But in this, I don't think we make changes in precedents. It's the reason we have things in place. If you start pulling that thread, you're gonna find we have more conversations and things. I don't think we can do that. So my motion is that, thank him for coming in and sharing, and maybe we can look at it in the future, but as of now, I think we leave it as is.
Second?
I just would like to add maybe to that motion a little bit too, that maybe,
Can we have a second, then we'll
Okay.
discuss that? No second?
Second.
Okay, okay. Discussion?
I would like to say that, it would be unwise, I think, to give somebody a preferential treatment in any way without opening up a can of worms. But it might be something down the road to really look at the fee structures and see if there's something that's a little more fair for seasonal businesses versus big businesses and things too. But it is a matter no one wants to pay. I get that. But so.
Any other discussion?
Yeah, and I would tend to agree with Mr. Young that if we want to be flexible with all the types of entrepreneurship and other types of businesses, that we also try to accommodate that to the best we can. But that's a different discussion and more in-depth conversation.
Agreed. Any other comments? Got a motion on the floor. Yeah, we seconded, so we'll move forward. All in favor?
Aye.
Opposed? Passed. We're good. Thank you very much. Okay, we're moving on to staff reports. Ms. Albee.
Good afternoon, Vice Chair, members of the board. In the Air Quality Division report this month, I did highlight the Alliance for Climate Education. It's an organization here in town that promotes environmental education for students, not only educating them, but giving them the tools to empower them to go out and make a change. The report actually cites one of their recent projects was to go out. The students did research on idling at schools and put the entire program together, not only implemented it, were we're able to demonstrate the effectiveness of the program, document and quantify the emission reductions, but then also we're able to present it to the school district and got it built into their program. So this is a very active group. They do a great job in the community. They now have a new resource available, a new program, and it's called Our Climate, Our Future. And Rebecca was going to be here, but I guess she's not. This is a trailer. What this is it's an online packet of information. It's the entire lessons plans, everything that schools can use in the classroom for the children. And this is a trailer that introduces it. So if we go ahead and share that.
Our Climate, Our Future educates young people about the science of climate change and empowers them to take action. We bring climate science and solutions to life through our signature mix of animation, video, and interaction. We'll show you why the story of climate change isn't just about melting glaciers or disappearing polar bears. It's really a story about us. It's especially important for young people to know about climate change because this is the future we're going to inherit. We didn't start it. We don't want it. But it's young people who have to make the choice to stop it. We're here to help. This is Our Climate, Our Future. Sign up today.
So as you can see, it's very energetic. It's a great program. We will be promoting this throughout the community to any schools or organizations, any of the children's groups that are interested. This also does support our Ozone Advanced program through our outreach and education. So if anybody has any questions or they're interested in doing that, I put their information in here. You can also get a hold of me and I'll make the connections. I did have one other update from yesterday. I did go over and attend the Reno City Council meeting. I believe I'd provided information that they were looking at. City of Reno's was considering selling the piece of property that our Reno 3 monitoring site is located on. It's part of urban development. We understand these things happen. And so we're working closely with the city on where we can find another location that will meet the EPA siting requirements. Went over there, spent the day, actually had the opportunity to meet the developers, talk with a lot of the staff. Councilman Delgado was instrumental in helping me get up to the podium when I needed to so that we could keep things directed the right direction. I really appreciate all your help yesterday. And then Assistant City Manager Bill Thomas stepped in, and it's looking like the city is going to try to find a location for our monitoring site and dedicate that use to the site. So hopefully this will be the last site. So Reno 4 will be hopefully our last one that we'll have to work with. We've had relocations off of Evans Avenue when the road ended up going through, and we used to be located over behind the men's club, and the train trench came in and we got relocated again. So fingers crossed, this time it's going to be a permanent location and we won't have to keep redoing these moves. Got great support from the developer. They understood the timelines. As all developers are, they're in a big hurry to get started tomorrow, but the systems are in place to make sure things are done right. Just based on what they identified in their presentation, between letters of intent, due diligence, special use permits, and then escrow, they identified about 6 or 7 months. And then building permits getting issued, it takes it out to about 9 months. So we're thinking that we've already notified EPA that this was going to be coming. We're going to proceed to get some initial approval of the site, which that will help the city of Reno in the dedication of that land. And we will hopefully get going, get built, do co-located collection of data for a period of time that we can negotiate with EPA, and then we will move into the next phase of Reno 4. Mm-hmm. So if you have any questions, I'd be more than happy to.
Any questions?
Yeah, and if I could just add, Ms. Alvey did a great job outlining the importance of making sure that we are tied in with development, but more than anything else, the importance of our air quality control. That is essential, and that we make sure we find a good place for it. So thank you for spending time there. thank you for informing and educating everybody about the importance that we work closely with the health district. And more than anything, I appreciate the communication. You know, when things are going to happen among the city and sometimes other jurisdictions or other entities, sometimes that communication is lost. So I appreciated you spending the day there with us and informing and educating everyone on what needed to happen. So thank you so much.
You're most welcome. Just for the board's information, the Reno 3 site is our ozone design value site. So all of the data that went into our attainment designation came out of that site, and our exceptional events package supported that data. So it's our important ozone site. So.
Any other questions?
I'd also like to, as Oscar Delgado said, it's just so important that staff, and I'd say this to all staff, if we're having something at the city that you know is hitting our dais, please, you guys help so much because we do value, and we also can stand with you. And so thanks for going down there. The other thing, though, you mentioned, and I think it's good for us to hear, is that the people that are possibly moving onto that site might also be helping us pay to move the portion. I didn't think I heard you mention that.
No, I didn't mention that, but that was something that the city of Reno did suggest, that as part of the purchase of the property, that the relocation expenses could potentially be negotiated into the sale. So we will keep our fingers crossed. I did announce that we do not have budget authority this year or next year. The expense is going to be about $150,000. So that's something that is a challenge that we're going to have to get through, and there was a conversation about that. So when I see it in writing and they let me know it happened, then we will all celebrate.
Good. Any other comments? One question, this video that we just saw up there, do we control that? Who controls this?
ACE does.
ACE does, okay.
Mm-hmm.
It's not the school district, it's...
No, ACE
ACE.
is a nationwide organization, and this is the chapter that's located here. And so they actually have a launch kit that they will give to the school or whatever organization wants to use it. And the trailer was just part of their advertising and marketing to get the word out.
Good, I think it's great that we get it out to that whole age group, no matter was it Washoe County or not. So terrific.
Absolutely.
Thank you.
All righty, thank you very much.
Okay, moving right along. Mr. Cutts. Always exciting news here.
Good afternoon, Vice Chair Novak and members of the Board of Health. Steve Cutts for the record. Just a couple of updates for you. So this next Monday, Jennifer Howell, who is our Sexual Health Program Coordinator, will be on Ask the Doctor. As part of National STD Awareness Month, she'll be highlighting syphilis, specifically congenital syphilis. So we're excited to have her on that program. Second, I just wanted to, in our board report, and there was recent press release sent out regarding our mural in partnership with Reno Housing Authority and Glenn Duncan and Trainer Washoe County Schools. We will be doing that a week from today, Thursday, May 3rd at noon at the Reno Housing Authority offices. I know Councilman Delgado had a nice quote in there. I believe you're going to be there. I believe Chair Jung is going to be there. There'll be a number of us there, so we're excited about the press conference and highlighting the great efforts of not only our chronic disease prevention program, your chronic disease prevention program, but the partnership with Reno Housing Authority and the Washoe County School District, and we're very excited about that. Also within the chronic disease prevention program, I just wanted to highlight our work in the program regarding addressing the health impacts of marijuana in Washoe County, particularly secondhand smoke. We have begun exploring media campaigns, and we believe that that's important that we educate the public. So we're looking forward to our efforts regarding that. And we also have been expanding, I would say, our partnership within Washoe County with a work group that we have. And so we're looking forward to building on what is just starting to be our beginning efforts in promoting the, or educating the public, regarding the effects of marijuana use, secondhand smoke, etc. Third thing I just wanted to highlight to you was at the last Board of Health meeting, I had mentioned that I would invite Heidi Parker, who is the Executive Director for Immunize Nevada, to this meeting or May's meeting. She is not available for either. And so in speaking with Ms. Parker, we thought that it would be a good timing if she was at our September Board of Health meeting. So that is the plan at this point in time. She will recap our recent flu season, as well as talk about plans for flu season 2018, 2019, and outreach and education efforts that will be taking place.
Terrific.
With that, I'd be happy to answer any questions you may have.
Any questions?
Yeah.
Go ahead.
Just to add on, I know I had a meeting with several parents at Glen Duncan Elementary School not too long ago, and they both, everybody was so pleased with the mural. Everybody was excited that they also were able to participate with the artists, and I think that's so essential when you have community members that are also part of the art and everything else that's taking place. And so thank you for doing that.
Well, yes,
families really appreciated it.
Yes, and thank you for your involvement and the promotion of it. And we're very excited. It really was it's been a great project between, again, our program, the residents and the citizens within that area, the schools and Reno Housing Authority. So it's been a wonderful partnership and collaboration.
It's pretty awesome for the kids to say, that's me up there, that's my silhouette, right? I'm part of that. They could point to it, and I think that's awesome. So see you next Thursday. Appreciate it. Thank you.
Terrific. Any other questions? Thank you very much, sir.
Thank you.
Okay, moving right along. Mr. Westham, you're up again.
Thank you, Chad West for the record. You have our report, and I'm available for questions. Just a few highlights. A little newer than the report, Washoe County Health District, we did have to respond last week, and we've been responding this week to the recalled kratom products that were found, and we had a case of salmonella. We did a press release, and so we had staff go out last Friday after the products were found for sale. They were our EPI program. We worked closely with them, and they identified a salmonella contaminated recalled product from the FDA, and it was at a local smoke shop. So staff went out there and put the product on hold indefinitely, so that no other persons in the community would buy that batch, and thereby protecting and preventing hopefully another salmonella case. So that was exciting, and the report also shows, I highlighted that's too new for the report, but in our report you'll see we've added the 2017 numbers as requested at the last board meeting, so you can compare our work with what was done last year. We've been working very hard with the land development and community development projects. We have our turnaround times on a downward trend, with staff working very diligently. And routine inspections, as the report shows, we are working very hard at that too. We had staff recognitions this morning for their great work on the first quarter of 2018. And there was over 2,000 routine inspections done in January, February, and March. So we had a little celebration this morning, and that was very lively and fun. Any questions?
I have one.
Councilman Dyer?
A question regarding mosquito. I see that we already sprayed once. Are you anticipating need of extra this year? What do you? I know last year we had to go back to I think the Washoe County, get some more money and do some different things to make sure we could have enough. What are you anticipating this year, and how are we doing?
So yes, the helicopter has been flying this week, and they've been spraying the areas and trying to spray more. Right now, I'm working with Jim Schaefer, the supervisor over Vector to get he just needs to show me and us a plan for the pesticides and other chemicals that are used. And so right now we expect it to be standard response, nothing extraordinary, and we're just making sure that we have the appropriate supplies and that it'll be used at the appropriate times as we go through the season, and that there'll be enough budgeted and appropriate for next season as well.
Thank you.
Do we use a spray or do we use pellets? What are we using now?
Chad West for the record. There's a variety of sources. There's the what's used in the helicopter. I mean, there's some pellets and sprays, and I'd have to get back to you with details, Dr. Novak.
That's right. I just wondered if there was preference to use one over the other, or is that kind of seasonal?
I learned more about mosquito control last year than
you needed to.
and I had intended to. And I can tell you that the larvicide is a pelletized product that gets sprayed from the helicopters, and then when we actually have West Nile virus in the mosquito population, that's when we're spraying the pesticide, which is a liquid that gets aerosolized.
Good. Thank you. Any other questions?
I just want to make a comment. This 2,000 plus inspections is it's pretty aggressive, and I assume it's not going to stop for the rest of the year and things too. And I just wanted to give you guys heads up for good job in getting stuff done here.
Thank you. We appreciate it. We've been recognizing staff. This morning was exciting.
Okay. Sure. I just wanted to add one thing on the response that we had on the kratom and getting recalled products off the shelf last week. This happened as it typically does to us at about 4 o'clock or later on Friday afternoon. And so I just wanted to acknowledge the team effort and cooperation that we had in making that happen. We had a retailer who was initially uncooperative. And so Ms. Admirand helped us with our crafting a letter that sounded nice and legal on what they needed to do to cooperate with us. And City of Reno, both the business license department, Michael Schomp, it was not a business that the health district permits. So we worked with him to include some stuff with a little leverage on the business license. And then Reno Police Department also accompanied our inspectors on the second visit, and we had very good cooperation at that point. So I just wanted to recognize everybody's help and thank City of Reno for their help with that. Thanks.
Thank you.
Thank you.
We good? Terrific. Moving right along. Dr. Todd, Epidemiology and Public Health Preparedness.
Good afternoon, Randall Todd for the record. I wanted to just start out on the kratom issue and mention that apparently, this is not unique to our community. It's been going on for a while in other communities. And my understanding is that there have been 132 cases of salmonella in 38 states that are associated with this product. So I just thought you'd find that interesting. Also wanted to talk about measles. We had a case of measles, and I have a fairly lengthy paragraph in my written report about the efforts that we undertook, and it wasn't just my staff. We had people from my division as well as CCHS, EHS, and AHS all helping out in this effort. And some of you who are old enough to have had measles or who remember when measles was a more common disease may have had a reaction to this of, my goodness, this just seems like overkill for one case. But the definition of an outbreak is when you have more cases than what you would expect to have. Well, the last time we had a case of measles in this community was, I believe, 1998. So we don't really expect to have any cases of measles anymore. In fact, measles has been declared eliminated And that doesn't mean we never have cases of measles. It means that we go for 12 or more months without any continuous transmission of measles. So the cases we get tend to be imported. Somebody travels overseas, they get exposed, they bring it back here. And if they then are, sometimes they will expose unvaccinated people in this country, and so we'll get a few cases. Interestingly, our case was vaccinated, had both doses of vaccine. So 97% is the protection factor. So that means only about 3% of people who have had the 2 doses of vaccine, but who then get exposed to measles will get the disease. And so this unlucky individual fell into that 3%. And he was actually exposed over in California. California had, I think, 6 cases associated with a traveler who had come back and brought it there. In our investigation, we had 9 suspected cases that 8 of those 9 tested negative, and we were able to rule out the 9th case without testing. The last day for symptoms for those who were exposed to our confirmed case was April 23, so we have passed that date. We had 2 contacts that had to be prophylaxed with IVIG post-exposure prophylaxis. The last day for symptoms on those 2 individuals, one was today and didn't have any, and the other will be day after tomorrow on the 28th. So that's good. To put this into some additional perspective for you, back before 1963, when the vaccine became available, there were between 3 and 4 million people infected each year in the United States. When I read that on the CDC website, it boggled my mind. And I was probably one of those, because I had the measles way back when. There were between 400 and 500 deaths in the United States every year from measles, and 48,000 hospitalizations each year from measles, and 1,000 cases of encephalopathy that were related to measles. So it's a major public health achievement that we've gotten this down to where we consider a single case to be such a major public health event. And I'm pleased for all the efforts that staff from my division and the other divisions put into to making sure that we kept it to just the 1 case. Moving along, you'll see in my report that we had another carbapenemase producing organism case, which we investigated. But along with that, actually not because of that, but back because of the pan-resistant case that we had and we've talked about several times, we continue to get media interest in that. And so Dr. Chen and myself were both interviewed by a German television crew that came here and spent quite a bit of time interviewing us. They're going all over the world to do these interviews, and my understanding is this will air sometime in 2019, so we'll have to be patient to see it, but that gives you time to learn German, I think. We just got our week 16 flu report today, and I know in the past I've kind of gone through and updated the numbers, but I think if you want to do that, you can just go to our website and look at the report. It'll probably be more meaningful to you that way. What I will mention, however, is that flu continues to go down, so we appear to be on the tail end of the flu season, and that's a good thing. But for laboratory confirmed cases, we've had a total so far of 5,434 lab confirmed cases, so that's a pretty big number. We've had 529 hospitalizations, 84 intensive care unit admits, and 25 deaths. And I think that death count is higher than I've ever recall seeing for influenza. So that's laboratory confirmed cases that died. And that's a little bit different from the P&I deaths that we talk about, pneumonia and influenza, so we look at that as well, but those are unconfirmed flu deaths. And I believe that's all the comments that I had. Would be happy to entertain questions if there are any.
Any questions?
I have one.
Sure.
Only because I have no idea what measles really are now that I'm sitting here listening to you talk, and I don't know, maybe I'm the only one in the room, but as you talk, I'm thinking, and I could look up Google, but I figure you're better than Google. So,
Well, I don't know. Google is a pretty amazing source of information.
what exactly is?
So measles is a viral illness, and most people think about it as a rash illness. Generally, the rash will start on the face, and it'll work down. So you get these pinkish colored spots on your face, but they'll move down the rest of the body. Over time, they will start to merge together, so you'll get some patches, and they may get raised bumps in the middle of the measles lesion. It often starts with a prodrome of fever and other symptoms, including some white spots in the mouth, but those often go unnoticed. So the first symptom that people really notice is the rash.
You're making me itch thinking about it, but thank you. That's interesting. Well, thank you for making it so we don't, let's continue to make it so this isn't something we all know about, right?
Right. So when we talk about measles, we're generally referring to the hard measles. There's also the German measles, which is a slightly different disease. So when you get vaccinated nowadays, you get what they call the MMR vaccine. That's measles, mumps, and rubella. So you get protected against all of those. And we did have to exclude a number of individuals, in particular at the university. There were about 300 students who had opted out of getting a measles vaccine. A couple of hundred of those were actually taking courses on campus. Another 100 or so were off campus, so we weren't as worried about them. But we had to have a number of students excluded from campus because they had opted not to be vaccinated against measles.
Thank you.
And for a few of us older folks that have had measles, it affects your hairline, right?
Yes, it does.
Is that what it?
That's what happens.
So 3 of you have had measles for sure. Oscar, maybe?
Yeah, you came close to dying from it.
Yeah. I don't know, I think Dr. Hess must have missed it.
I had it too. The difference also, is you get pretty sick with measles.
You can, yes.
Yeah.
Okay. Mr. Health Officer, thank you very much. Dr. Todd?
Actually, just to briefly follow up on Dr. Todd's report on the measles, I also wanted to acknowledge the great cooperation that we had from UNR, Dr. Hug English over there, and working with President Johnson on the communications to the campus and on the exclusion of the unvaccinated students over there. So it was very close contact, and they cooperated with us fully. Very much appreciate that. Few things. Mr. Ulibarri placed our 2017 annual report on the dais for everybody. So I wanted to thank Mr. Ulibarri for his efforts in developing that, and the division directors for working with him on that, and anybody in the audience that wants one. I believe there's a stack by the comment cards in the back of the room, and we'll be distributing these more widely in the community. Yesterday, the county manager presented the FY19 budget to the Board of, well, actually it wasn't yesterday, it was Tuesday, several days ago, presented to the Board of County Commissioners. And so the budget for the health district moved forward with the above base requests that we had built into it with our revenues. So the positions that we had added that were supported through revenue that was in the health fund, the above base request for the mosquito abatement that we had built in anticipation of the additional standing waters that we still have from the flooding last year was not approved. And so if we need that additional chemical for the larviciding and the budget for the application, we will be, our intention is to go back to the Board of County Commissioners seeking that funding as a supplement to the budget during FY19. The public health accreditation work continues, and I think it's since we put this report together, we had an opportunity to submit some sample documentation to our accreditation manager to have the FAB, Public Health Accreditation Board people review it and give us some feedback. And we did get some feedback on a few documents, and I think that's helping improve our understanding of what's required. We'll continue to work so that we're as close to the mark as we can be when we have all our documentation submitted October 1. And hopefully have a lot less work to do then as a result of the site visit that happens. On the water projects, we just heard earlier this week that apparently there's a hiccup between LCB and NDEP on the NAC revisions that they were moving forward, and so we may not be hitting the schedule that we were shooting for to have the SEC approve this before the end of the fiscal year. But I'll continue to report on this as we get any more information with that moving forward. We're also continuing to work on alternative approaches for the way we conduct our regulatory oversight of TUMWA. And so we have a meeting actually set up on next Friday with NDEP, the Health District, and TUMWA to be discussing formalizing that sort of an oversight structure. And as we're envisioning this would be an interlocal agreement that would come back to the board for approval, as well as NDEP and the TUMWA board. Again, I'll continue to keep you updated on those discussions. We're continuing to work with Truckee Meadows Healthy Communities and development of a community health improvement plan. And at the last meeting, Councilman Delgado, you'd asked about the Renown's community benefits contribution, and I talked to Dr. Slonim, and he was not available today, but he has requested to come and be able to present to the board on that at the May meeting, so we'll get him agendized for a presentation at that point. And let's see, if you wanted to start queuing up we have actually a mural as well of the Trainer, or a video of the mural at Trainer Middle School, or I guess some pictures of it. And the way this was done, these are actually students from Trainer Middle School, and I don't know what the term is, but they did they projected their shadows, and the artist, a silhouette of them that they used to showing their favorite foods and healthy foods, those types of things. So I think it's turned out very, very well, and a visual upgrade to that wall for sure. So I'm looking forward to that.
Is that right? Is that what?
Excuse me?
East 10th Street, yeah, that's pretty neat.
Backside wall where the Green Housing Authority has their buildings.
And then the last thing that I wanted to report on is on Tuesday, had an opportunity to present to the Interim Legislative Committee on Healthcare. We had a joint presentation between the 3 local health authorities in Nevada and the State Division of Public and Behavioral Health and the Nevada Public Health Association. And we were provided 2 hours on the agenda for a presentation in which we talked about the public health infrastructure in Nevada, funding for public health, what we do with public health, and the future direction of public health. I did a presentation on Public Health 3.0. I'd done some of those slides and talked about that with the board previously, and looking at community engagement and working together to address social determinants of health. And then we also proposed the need for more flexible and sustainable funding from the state for public health. The state of Nevada is 50th out of 51 states in public health funding. It's 51 because they count the District of Columbia. I believe if they counted Guam and American Samoa, we'd probably be even lower in that per capita funding. So I believe it's about $6.75 per capita. If Nevada was to allocate another $1 or $2 per capita for public health, we would still be 50th. If they were to allocate $3 additional for public health, that would bring us all the way up to 49th. We asked that they allocate $5 per capita for public health. That'll still keep us at 49th. But we think that we need that kind of funding so that we have the ability to support the work with the community, to be responsive to the health needs that we identify in our community health needs assessments versus the type of funding that we typically get, which is tied to a specific federal program for immunizations or family planning, or we call them the body part type grants. But we really were pushing strongly for a better investment on the part of the state. And I'm pleased that while we were provided 2 hours, the meeting started late because of some technical difficulties, and we still got our full 2 hours and more. We're not trying to be rushed out of the room. The committee was very engaged, a lot of questions and discussion. It's actually the most that I've seen them engaged in my career around public health. So it was a great opportunity. If anybody's interested in that, it's archived video on the Nevada Legislature site for any interim health care committee meeting of April 24th. That's Senator Spearman, and so that interim health care committee is a mixture of both Assembly and Senate people from their health care committees, and Senator Ratty is on that committee, and Assemblyman Mike Sprinkle is also on that committee as far as our local representation.
Any questions?
I have one, just in regards to what you said. I'd be interested to know, which to say we even go a little higher, what is it that someone in the 40th percentile gets to offer that we don't get to even look at? What are the benefits? I mean, obviously there's benefits because we're helping people, but the tangibles. So if we're actually talking about this, what kind of stuff does start happening when we have more money to do it?
So I'm glad you asked that question, because part of the presentation, and it's one that Dr. Iser from the Southern Nevada Health District did, was on foundational public health. And there are several different states that have worked on figuring out what are the foundational services, not the whole house that might be constructed, but to have a strong foundation for a public health program. What are the things that you need to be able to deliver? And then you can start building more of a house on top of that, but if you don't have the foundation, you're never gonna have a good house. So he presented information about work that Washington State has done to identify those foundational capabilities and cost them out. And with a proposal that we do this here in Nevada, and we have the 3 local health authorities and the State Division of Public Health working together on identifying what those are and costing them out for our state to be able to take that back for the legislature to consider. And so the ask was that they use some of the interim funding that they have to provide funding support for us to get a contractor to help support that effort. Perhaps one that's done work like this up in Washington State or one of the other states that's done that. We think that realistically, though, we're not going to be able to get through that process in time for the next legislative session. And so we basically put forward this initial ask of a block grant type funding for that flexible funding using the additional $5 per capita. And then we come back to them when we have the results of that foundational capabilities evaluation and assessment that could be acted on during the following session.
I think it would be real valuable as that gets teased out, like at our next retreat next year, something to educate us on that, because I think each of us have some ideas, but you know, I don't know that we're all on the same page.
Yeah, that's a good idea. And in
Yeah.
fact, Dr. Reiser has a nice slide deck that he runs through that you should be able to see. And if I do it at the retreat, you might see it a second time.
Yeah, sounds good. Yeah.
I got one comment on the FAB and our public health accreditation. I was just at the NALBO board meeting in Atlanta this last week, and now there are 3 states that the state health department, everything is required them to be certified from here on out. And state has, and some of them have already put some money in to get it done, but they will now, by I think the start of 2020, will have to be certified. So we're going to keep up the pressure. Thank you very much.
I know you're not going away.
I'm not going to go away. Very good. Okay, thank you. Do we have any board comments? Anything you want to be put on the next agenda? The comments? Okay, hearing none, we're going to move into public comments. I've got 2 of them here. Ms. Anderson would like to talk about ACE. And I think Ms. Alvey started it for us.
Yeah, hi, I'm Rebecca Anderson, and I'm Director of Education with ACE, Alliance for Climate Education. And first, I'm sorry that I didn't make it here in time for Charlene's presentation, but I just want to say thank you to you all and to the county AQMD that they have been a really great partner of ours over the last 5 years. Yeah, that we've worked closely with on the Idle Free program with the schools and the school district. And we were really happy when we put out this new product to have their support in it. So just a lot of gratitude and appreciation for that. And I think Charlene said that maybe you guys had a couple of questions for me.
Anybody have anything? No, I just think it's a terrific program. I kind of like the fact there's a wider control over it than just belonging to one school district or something like that. Sounds like access can be everywhere.
Yes, yep, but we are partnering with Washoe County School District to make sure it gets into the classrooms there. I'd say primarily middle and high school classrooms, maybe down as young as 5th grade.
How do people contact you?
I can give you my email right now, but it's also the website is ourclimateourfuture.org, and then I'm just Reb, R-E-B, at acespace.org.
Good.
Yeah. So,
thank you very much.
Yeah, thank you all so much. We really appreciate the partnership.
Great.
We got one other comment, Ms. Brandhorst. She may want just a little bit more time.
My name is Kathy Brandhorst, and I am the United States President. I just wanted to let you know we still have a rapist on our property. I still live on C Street in Sparks. Of course, that's in Nevada. And I just wanted to let you know we still have people who carry machete knives, guns, rifles, high-powered rifles, bows and arrows. And as you can see, those police officers never had a chance at all. They are put in lights and then they are hung by their necks. Oh my! And they are hanging there all night long in lights. They put the lights all the way around their bodies. And they're not very big either because they've already been chopped up. And these people are releasing their lethal injections right next door to me. And they think that they can get their human bodies from people even walking in the alley. The garbage truck, who is the waste management, they have been picking up chopped heads, body parts. And these people never have a chance at all because they will grab them from the back They will grab them from their necks, and they don't even know that they are being dragged across the lawn and into the door next door to me. And these people are all squatters. They do not live there, and they're all on death row. And they think that they can get away with it. Well, yes, they have been getting away with it, and nobody seems to help us out, you know, with these kind of people. And yes, the diseases are also in their bodies. I have come down with cancer. And so other people are starting to complain that there has been more smells against little tiny kids. Yes, those are them. And they were just sitting there, you know, playing with their toys. But they have been sexually abused. And they are both dying with cancer. So I just wanted to let you know this is not very good, you know, for us to suffer, because these people do not live on the property, and they are the ones that need to be destroyed.
Thank you, Ms. Brandhorst. If I hear nothing else, this meeting stands adjourned. There you go.